Hi everybody, my name is Femida Gwadry-Sridhar. I'm the founder and CEO of Pulse Infoframe. I wanted to take a moment just to introduce the spotlight that we're doing on two registries. One, the OMNi registry, which is a global uveal melanoma registry, and the other, the INSIGHT registry, which is a patient-reported registry, both focused on advancing the goals of improving treatments and helping patients with uveal or ocular melanoma. So really pleased that we're also going to be talking with Danet today, who's from the INSIGHT registry, looking at how patient-reported outcome data, potentially coupled with data that comes from the clinical sites, can really advance the type of research that can be done in uveal melanoma. Really, we all have the same end goal, and the purpose here is to show that collaboration is possible, and together we're going to be better.
So trying to develop novel therapies or new and better treatments for patients with uveal melanoma is challenging for a number of reasons, but in part, because of the rarity, it's really hard to get a good sense of the biology clinical course of patients, how well certain therapies work in those patients. It's very challenging to do big clinical trials to answer some of these really important questions. And because of that, it's really important that we're able to learn as much as possible from every single patient. And one really powerful way to do that is to create registries where we can collaborate with institutions across the country, around the world, and share data to learn as much as possible.
So with the Ocular INSIGHT registry, we were really hoping to answer some of the questions of, is this really as common in the demographics that are statistically out there? We're also trying to answer some of the questions of how are patients dealing with their disease, from a mental health perspective. We want their input, and so this is a natural history registry in the sense that the patients have control over the data that they're inputting, and they get to really tell their story and contribute to research in a real-time way.
So how did this all start? Dr. Anthony Joshua, who was a principal investigator in another registry that we were running, moved to Australia, and he had a real interest in being involved in uveal melanoma. And so brought together two other principal investigators, Dr. Josco from Liverpool and Dr. Rich Carvajal, who was at Columbia University at the time, now at Northwell. And together with Pulse Infoframe, we conceptualized the types of data that could be collected from sites. And today, I'm proud to say that we have over 20 sites in the US, Canada, the UK, as well as Australia and soon to be New Zealand, contributing clinical data into this registry.
As these registries grow, it just really increases our global understanding of patients' potential etiologies of disease, what the natural history is, how they respond to certain therapies, and really what we're trying to get to is what is the best way to take care of these patients. And this is not just information from a single institution, but really this gives us a national and global perspective, which is really important.
I hope to see, as data matures, it would be important to be able to utilize that data, really democratizing the access of the data, but making sure that it's done in a respectful way. I think that historically what has happened in many registries is that people have collected data but not made it readily accessible. Now to do that, remember, we are getting patient consent, but we also need to have a process that helps people who are thinking about using the data for research really help them understand the types of data that are in there and then how best to utilize them, and to have a formal process to make sure that the data that are being used to support research questions and not just to mine data for the purpose of mining data.
So with the INSIGHT registry, we are gathering natural history data, and so what we're really hoping will happen is that we'll be able to collaborate with registries like Dr. Carvajal's Pulse Infoframe and this specific registry that is physician input, and we're really hoping to see that collaboration where the data can come together and we can make sense of it from both sides of the spectrum.
So the data that we're collecting, the intent is to make sure that this is widely available to everyone who can help, all the key stakeholders, right, who can help us advance the field. We want them to know what's in this data set and have access to it so that we can accelerate the pace of advances.
So one of the first things that we really want to emphasize is that every single patient's story is so important. Every patient's story matters, and it doesn't matter if you are experiencing metastatic disease or if you've been stable for 20 years. We want to know what is going on in your medical history, what's happened in your diagnosis story. All of those things are important to just understanding the bigger picture. And we also really have a lot of diversity goals in the sense that, we don't want to just hear from the women who happen to be maybe on Facebook and Instagram. We want to hear from everyone. We want to hear from the men in the community. We want to hear from our minority groups. We really want to hear from everyone in this way so that they get the chance to have their story told and their story heard.
Something that's really positive in the field is that there are multiple registries and real-world data sets being collected in uveal melanoma. And I think what's important to note is the data that's being collected in each of these are really tailored towards different purposes. And although it might seem ideal to say there should be one master registry collecting all of the information, answering all of our questions, in reality, it's just not feasible. And so the fact that there are multiple efforts going on is really, really important. And the fact that we're all trying to work collaboratively toward the same goal, right, is really, really positive.
In a small, rare cancer, we're always going to be better together. And the data, the information, everything that can come together is going to be another piece of the puzzle. And Dr. Carvajal's registry or another registry that is formed, let's say in 5 years from now, it's going to have some pieces of the puzzle, and we have some pieces of the puzzle, and all of those pieces have to come together. And if they don't come together, we're missing something. It's so important to recognize that there's no politics. It's just about collaborating and being stronger together with that information coming together and linking.